Okay, so this video is about hospital organization, and I decided to create my own video about this using one particular example because I really couldn't find any resource. And for this particular topic, I have chose an integrated delivery system that is native to New York, and that is the NYC Health and Hospitals Corporation. So the NYC Health and Hospital Corporation is a public integrated delivery system in the city of New York, and it's owned by a not-for-profit corporation that is affiliated with the city of New York. Before we talk about the hospital organization, I want to show you this website. They are composed of several healthcare locations. They have hospitals, they have community health centers, they have neighborhood health clinics, they have long-term care facilities, post-acute, even correctional health services. So this is one perfect example of an integrated delivery system that is found all over the city. For instance, let's look at the hospitals. You have all these campuses from the different boroughs, right? So I am going to use, again, this hospital, this integrated delivery system to illustrate the leadership, the organizational structure. So let's go to leadership. Even just from the tab here, you already see the three different sources of power. This is more for the different facilities that health and hospitals have. So first, the board of directors. While there are three different sources of authority in a hospital or in an integrated delivery system, which is the board of directors or board of trustees, the chief executive officer, the administration, and of course the chief of staff, which is the clinical aspect headed by a physician. The board of directors is normally looked upon as the one on top. It's really composed of quite a number of people from the community. They are not necessarily employees of the hospital. They provide advisory and steering functions. So the board of directors also wields tremendous power because they're the ones that hires and fires the senior executive, specifically the chief executive officer, the CEO. So let's take a look at their board of directors. Jose Pagan is the chair of the board, and the CEO is actually a member of the board as well. But this guy, for instance, Stephen Banks, is not an employee of NYC Health and Hospitals. He is actually the commissioner for the New York City Human Resources Administration. So members of the board are people that have a stake or stakeholders in the operation of the hospital. They are the ones that have a vested interest in the success of the program. So take a look at all these folks. They are members of the board. You could visit this website yourself to study this organization. Then let's look at the senior executives. Now, the senior executive is headed by Dr. Mitchell Katz, and he is a physician, but he's also, of course, not only in charge of the clinical aspect, but also the administrative and financial aspect of the hospital. We have the chief medical officer or the chief of staff, Dr. Allen, Mashal Allen, who is also a physician. And then you have senior vice president here. She's a lawyer, JD. And that's the external and regulatory affairs. That's very administrative and also compliance. There is a chief nurse executive, Dr. Natalia Sineas. She's a doctor of nursing practice. Then you have Dr. Choksi here, who is the Vice President, Chief Population Health Officer, and so on and so forth. So if you go down, these are all the executive leadership of the New York City Health and Hospitals. Now, normally we think of hospitals as a unit, and this is an integrated delivery system comprised of different hospital campuses, as a matter of fact. So if we looked at the facilities here, each facility has its own CEO. So for instance, Gregory Caliste is the Chief Executive Officer of Woodhull Hospital, which is part of NYC Health and Hospitals. The Harlem Hospital Center, Harlem Hospital, is headed by Ms. Carrington, Ebony M. Carrington, and so on and so forth. For Bellevue, we have William Hicks. For Kohler, we have Robert Hughes. This is the primary ambulatory care arm of NYC Health and Hospitals, and it's headed by Nicole Jordan Martin. And so on. These are the heads of the different campuses of this huge integrated delivery system. So I hope that gave you a good background of how hospitals are organized. And like I said, this is the best example I could actually find. And again, just to repeat, the board of directors is that source of authority that actually wields a lot of power, because the board of directors hires and fires the CEO, which is on the top of the chain of command among senior executives.